Well, the Institute for Clinical and Economic Review, when we finally got a new but very expensive targeted biologic treatment, did a huge analysis of the economic burden of this disease, and they calculated that in terms of quality-adjusted life years, that spending $30,000 or more on a drug for this disease is well worth it. So what are the costs besides just the personal costs to people? And again, atopic dermatitis doesn't kill you, but it just ruins your life. So with these kind of diseases that have an impact on the quality of people's lives, what is that made up of? Missed work days, missed school days, missed educational opportunities, impaired sleep, and then more than that, the economic impact on the country is about emergency room visits and urgent care visits and doctor visits and use of multiple different kinds of medications, some of which are effective and some of which aren't effective. But all those things really add up. I think for this disease, and really for all diseases, as we have medication innovations, first of all, it costs an average of $1.5 billion to bring a drug to market. And so, that's a big investment that companies are making in new drugs. And then new drugs are expensive, and there's a whole host of reasons why drugs are expensive, and it's beyond our ability to discuss that right now. But with new medications, one of the biggest problems that we have is just having people get access to them. And step edits and payer requirements, really interfere with getting the best medications for people. And I think the impact of that is because if you give the cheap drugs to people that don't work as well, or especially because the less expensive ones are medications that aren't intended to use, and that's topical corticosteroids. Those have been historically around for a long time. There's cheap ones, but they're not intended for long-term daily use. So we want drugs that are going to maybe modify the disease course, or at least to put it into remission and keep it under control. And initial treatment to do that requires use of steroid-sparing medications, which are a little bit more expensive in the topical realm. And then for people who have more severe disease that brings them into the emergency room in the hospital, that takes systemic medications. And the older systemic medications are systemic immunosuppressant, nonspecific that require blood tests and that risk systemic immunosuppression. Those aren't the best drugs for long-term use either. So, payers have a big impact on access to medication, and it is a huge struggle. It's the number one dissatisfier among healthcare providers about, trying to get access to medication for people. And it takes up a lot of our time and distracts us from taking care of patients.
The awareness about eczema or atopic dermatitis among many medical specialties, among pediatricians, and others that are stakeholders in the healthcare system is very low. And that is part of our mission at the National Eczema Association, is to unhide eczema. It has long been an underserved and underappreciated disease. The impact of the disease has been underappreciated, and we have a lot of educating to do. Many, many people, I'm sure including many audience members who may be watching this, may experience the disease. 31 million Americans have eczema. And if it's just a little disease that they get, a little rash they get in the winter, and they put some cream on and off it goes, they think, oh, it's just a rash. And luckily for mild disease, it is very controllable. But for moderate to severe disease, it is not. It's a whole new ballgame. And the level of education and awareness about what it takes to treat and manage the disease and what that impact is on the patient and on the family and on society is our work ahead of us.
So the economic burden of atopic dermatitis is now being studied. And of course, again, the reason people study that is because when you have new expensive treatments, somebody's got to pay for it. So you have to know whether or not it's worth it. But first of all, atopic dermatitis is 10 times more common than psoriasis is. And the incidence of moderate to severe atopic dermatitis is about equal to the incidence of all of psoriasis. It's ironic because psoriasis was focused and studied earlier than atopic dermatitis, and now we have many different biologic and targeted treatments that are available for psoriasis, and we only have one new treatment like that, a systemic treatment for atopic dermatitis, although a robust pipeline. But, you know, the economic burden of atopic dermatitis is much higher than it is for psoriasis.